And that's been a huge change in the way that we diagnose and treat diseases in the horse. Um, so as we have gone from a very primitive look at dentistry back 3,000 years ago up through modern dental practice today, the biggest thing I think that's made a difference is that we're now basing what we're doing on a better understanding of anatomy, physiology, pathophysiology, and that we're using evidence where we're starting to keep better medical records. We're doing retrospective studies and comparative studies on different techniques to where we're actually evaluating the results of our techniques. We're not just depending upon testimonials from people that they worked. And so I think that because of that, we're doing a much better job of taking care of horses and serving clients' best interests and getting horses healed up that have had these problems that have been plaguing them since we've introduced the bit into the horse's mouth. And so I think that modern techniques have evolved because of this better evidence. And nowadays we know that to be able to treat dental disease, you first have to diagnose dental disease. I think for many years we had instruments that could perform procedures, and then we sort of started looking for a disease to treat with them. So and so we had these new power tools that we're using in horses' mouths, but we didn't really understand anything about malocclusions and the different types of dental disease that cause malocclusions, but we knew we could grind a tooth down. And so but I think now we're starting to look at why horses have different types of malocclusions and why different types of elongations form in the horse's mouth. And they're all associated with some other dental problem. That the healthy tooth is the long tooth. It's the opposite tooth or the way the jaw's lined up that's caused that elongation. And so those are the problems that we really need to address. So a complete oral exam is vital to everything that we do. And we know that the oral exam needs to be composed of both looking at all of the horse, but you also need to get a good complete history and a signalment on the horse. You need to look at the entire horse, both the extraoral and intraoral part of the horse. You need to look at the skeletal conformation of the horse's head and face and jaws, oral soft tissues, oral occlusal wear is important, and then the periodontal status and the endodontic status of each tooth. And so we've sort of, when I graduated from veterinary school, there were 6 dental diagnoses that we learned of horses, and they were sharp enamel points, hooks, waves, shear mouth, ramps, and secondary sinus infection. And we didn't really know what the disease was, but it must be caused from a bad tooth if it had an odor to it. So that was basically what we learned. And so we've gone from the point where dentistry was, like Marlett said 100 years ago, based on sharp enamel points and dental overgrowths, to now understanding that there's a lot more to dentistry than just grinding teeth down and floating teeth. So it's important that you evaluate the entire masticatory system on the horse. And we know that includes more than just looking at the teeth.